What's up, people? Welcome to my YouTube channel. Sorry, apologies. I want to highly apologize for taking so long. I know, yes, even you know. One question: have you subscribed? Now, I want to promise, like, we're gonna have videos every single week. My prayer, please pray with me that we learn all this together. And yes, health is what matters. And with this, we are gonna help the population. So now, yes, I know we had begun initially on a series of allergies, but today I want us to talk about a very passionate topic so that we all know where we are coming from. You all know that I'm a registered nurse, Kenya registered nurse, and I want all of us to be educated about what nursing is all about. And if you're a parent and you want to take a child to do nursing, you can guide them well. If you're a graduate nurse, you can know what to do next. If you're a Form 4 school leaver trying to think that you're gonna want to get into nursing, you'll make the right decision. Welcome to nursing. So I like telling everyone, like, nursing is not for everyone. Yes, nursing is not for the faint-hearted. Nursing needs you to be strong. Nursing is for the intelligent. Nursing is for the compassionate person. Yani, nursing takes your all. So if you're not strong, if you're not intelligent, if you're not compassionate, don't try this at home. Yes, don't try this at home. One of the greatest aspects of being a nurse is that it's a profession where you work in many types of environments. In many roles, it is consistently evolving. Like the nursing of Nightingale is not the nursing of Emily, of Emmy Dave. Yes. So the registered nurse can work in a bed, or can work at the bedside of the patient, can work with sick patients, can work with well patients, can work with children, can work in a palliative center. So for every individual, there is some personality that exists with a nursing specialty. Trust you me, a nurse who works in as a midwife cannot work well if you take them to work, for example, in a palliative center. Nursing is a career whereby when you establish yourself in a certain specialty, you kind of get deep rooted. Your personality is geared towards that, and you can be able to thrive in that environment. If you are uprooted from that area, patients start suffering and your output becomes compromised. So, as I said again, to every individual, there is a temperament inside of them that dictates them to work properly in a certain specialty. So now, where do nurses work? Nurses can work either in a hospital, nurses can work in a skilled nursing facility, nurses can work in outpatient centers, nurses can work in physicians' offices, nurses can work in clinics, nurses can work in insurance companies, nurses can work with the government, nurses can work in a community health setup, nurses can work in schools, nurses can work in universities, nurses can work in corrective centers, for example, prisons and all those areas. Now, every single nurse, when they graduate from the nursing school, we have, for you to be a registered nurse, you'll have done either a diploma or a degree. For you to do a degree, you'll have achieved the pass according to the Joint Admission Board. They admit you to a university of choice according to what you chose. Then you'll study for 4 years and go do your internship for 1 year. For a nurse diploma, you'll have gotten your grade and then you'll apply to the elementary college. Then you'll be admitted, you'll do your nursing for 3.5 years. Then from there, you'll graduate. All the two nurses will do the nursing council exam. I don't know about your state, but that's Kenya. You'll do the nursing council, then you'll be registered as a country registered nurse. So every single nurse who says that they are nurses should be registered by the nursing council. And anybody who is practicing nursing and is not registered by the nursing council, they are practicing illegally. So, after graduating and after working, a graduate nurse can work in any field. The curriculum of nursing of Kenya equips you to work all round, whether diploma or degree. You can work in any department. After working for a while, 1 or 2 years, you will kind of start advancing your career. In advancing your career will also depend on your personality and your exposure. But before you get there, let's learn on what advanced practice registered nursing careers we have. There are 4 advanced careers. We will have a nurse practitioner. When we talk about a nurse practitioner, this is someone who is specialized. When you talk about an advanced nurse practitioner, this advanced nurse, they have done their PhD program. They work in other countries. They are allowed to practice. They can diagnose and manage a certain population as nurse practitioners. They are licensed to work as a practitioner who is managing a certain population, and they're able to co-work with other health system members to ensure that patients or people are properly managed. In other states, they work hand in hand with a physician. That is an advanced nurse practitioner. That's the first specialty. Then we'll talk about a clinical nurse specialist. When we talk about a clinical nurse specialist, these are those people who have advanced. After getting their registered nurse qualification, they advanced their knowledge. In the nursing clinical nurse specialist, we have so many fields of study. They take comprehensive health histories. These people diagnose, they treat, they manage chronic illness. Now, depending on the line of duty you want to take, depending on the line of duty you want to take as a nurse practitioner, there kind of 5 areas you will settle on advancing your career. For example, it could be about a setting. It will depend on where you want to be based on. It could be a clinic, it could be critical care, it could be emergency room, it could be ICU, it could be a medical surgical unit. Depending on the setting, that is what you specialize on. Another way you can specialize is through a population. You'll want to specialize on children, that's pediatric nursing. You'll want to specialize on women. You'll want to specialize on geriatrics, that's old members of the society. You'll want to specialize on men. You'll want to specialize on just a certain population. Then now others specialize as per the disease. Some people specialize with cancer, that's oncology nurses. Some people specialize with disease, for example, cardiac nurses. Others will specialize on diabetic management. I was saying others specialize with cardiac. We have cardiac nurses, we have diabetic management nurses, we have wound care nurses, we have orthopedic nurses, we have ophthalmic nurses. So depending on the disease you want to specialize on, this is where you will put your focus on. Some people will want to focus on the health problem of a condition. That's where they will specialize. For example, pain management, for example, stress, for example, wound. Others may specialize in a health problem of an area, for example, waste management or something. Then others will want to specialize on care type. The care type, for example, psychiatric or rehabilitative, or some patients who are undergoing specific health condition, for example, ADHD, for example, a condition, let's say club food condition, and nurse specializes on that type, the care of that patient. So the 5 clusters will dictate what a clinical nurse will want to specialize in. And it's a wide range. Remember, I've told you the 5 areas. You'll want to specialize on the type, the setting, the population, the disease, or the type of care. So whatever way you want to specialize in, get your niche. If it's the setting, for example, myself, I am always accident emergency. In accident emergency, you don't specialize on a wound type or something. It is that setting. That is where it gives you the adrenaline you want to perform, and that's how you perform. Another specialty that we want to talk about is nurse midwife. When we talk about nurse midwife, the nurse midwife is another thrilling experience whereby they specialize in 3 areas. No, 4 areas. They specialize in antenatal, they specialize in postnatal, they specialize in mother baby care, they specialize in maternity setup, and in totality midwifery, well baby, well mother. Then they set these people when they are well off to other areas. That is midwifery. Then lastly, there is this nurse anesthetist. It's a new career in our country, but it's a specialty that is now being practiced in other areas where a nurse is specializing in anesthesia. Those are the 4 advanced practice nurse registered nursing careers. We have alternative nursing careers. Remember, every single career I've talked about, we will try to get a nurse who are specialized. For example, if it's a settling area, they will specialize on accident emergency. We will talk to that nurse and they will tell us how life is all about in that setup. Let's lastly talk about alternative nursing careers. I will choose not to advance my career according to the 4. That is not the end of the world. Remember, I told you nursing is evolving. It is interesting and you can work anywhere you want to be. So, alternative nursing careers, there are so many. You can never exhaust them. Number 1, you can be a clinical nurse educator. Clinical nurse educators are those people who, after doing their clinical specialty areas, for example, they specialized with gastrointestinal diseases, and now they have become nurse practitioners. Now they come back and educate people, educate student nurses, not people, student nurses, on how to be the next generation nurses. Those are clinical nurse educators. Then we have public health nurses. Public health nurses are those who've decided to specialize on public health issues. They kind of go to the society or the hospital, try to analyze areas that are concerned to public health, for example, waste management, waste segregation, and everything. Then that's what they do.
Back.
Then next we will talk about travel nurse. Travel nurse in our country, we call them pool or locum. They kind of travel from facility to facility where there is a staffing issue. They don't deep root themselves in any field or something. They are always on the move. They don't fix themselves in any facility. They attend to hospitals as per the need of that hospital. Then we have hospice nurse. Hospice nurses are those nurses who are entirely in a hospice setup with oncological patients, those patients who are having issues and they need palliative care. These are the nurses who specialize in that area. Then we have telephone triage nurses. E-medicine, as you all know, is coming of age, and this is the kind of nurses who specialize in triaging. They listen to the patient on the other line. They triage them properly, then refer them properly to the right specialty. We have nursing specialties. Now, these are other nursing specialties. When you talk about other nursing specialties, they're kind of others. They're nurses, but they're kind of others. Number 1, we have infection control nurse. Infection control nurse, this is not a totally career that you go to a school and you're trained about infection control. It is something that is gotten through experience. And after working, and if you did public health and a lot of exposure and a lot of trainings, you find yourself into this career. It's very interesting. You kind of get on top of the game infection control wise, and you manage infections in your area. Then we have quality management. Quality management in nursing. Again, there is no specific school that teaches nurses about quality management, But after getting experience and after getting advanced knowledge, you kind of learn on how to document procedures and policies and and how to implement them, how to raise non-conformities, how to implement this non-conformity, how to close the gaps. That's all about quality control. We have another specialty, case management. In case management, this is where you manage each case individually. Most of them work in insurance companies or in a hospital in liaison with insurance companies, whereby if you are situated in a hospital, there is a patient who has come in, for example, needs a surgery, you get in touch with their insurance. The insurance case manager gets to the details, see this patient is covered up to what limit, and then they say we have insured this patient, and yes, we can take care of this patient. And they even visit the patient and try to get to know more about them. Then we have charge nurse and nurse managers, and you all know what nursing administrators do. These are those administrators. Again, the school they go is basically management or administration, and with experience, all these careers come on board after experience. It's not a career that you'll become after 2 years after graduation. They come after experience and after another higher specialized education. Then at the end of the day, you also have a nurse educator. This is someone who educates the upcoming nurses and every single thing. One thing I want you to know is you will never ever replace experience in nursing. If I trained and I've gotten experience in accident, emergency, or midwifery, or intensive care nursing, or medical surgical nursing, you will never replace this experience with papers. As much as you are learned, experience is not replaceable. Usually, every single nurse is encouraged to go back to school, but after getting exposure and experience, you become a better nurse. Trust you me. You remember, before you do your final licensing exam, you'll have gone all around the hospital. And remember, what you write in that exam is not what you read in books, but what you've experienced on the ground. If a question is, for example, how to take care of a colostomy patient, you will properly remember what to manage after you have properly managed that patient. Nursing has never been theoretical, ever. Nursing is always about practical. Thank you all for watching, and I want to ask that whoever wants to be a nurse, do your due diligence. Whatever specialty you want to focus on, you can prosper. Know your specialty, know your temperament, know your personality. I wish you all the best. Thank you, and bye-bye.